Of course, we have a lot of listeners who are in the Palencia and sort of Nocatee area, and for them, going to your office in Ponte Vedra may indeed be closer.
Oh, it is definitely closer. We're about 5 minutes north of Palencia and just about a few minutes south of Nocatee, so it's real close.
And a lot of physicians' offices will have grand openings, and you have the traditional cutting of the ribbon, that sort of thing. But I think you're doing a really cool and interesting thing with your raffles. Explain to the folks about that.
Yes, we're really excited about the raffle. So obviously we're having a grand opening, ribbon cutting, and all that stuff. But what we're doing is we have a whole bunch of raffles going on for these gift baskets. And basically we're taking all the proceeds from the raffle. I mean, we're selling tickets for the raffles, and all of the proceeds are going to Donna Deegan, the 26.2, to support breast cancer.
That's really cool. Well, once again, the grand opening celebration at the new Ponte Vedra office here in St. Johns County will take place when?
September 30th from 4 to 7.
That's right. That's a Wednesday. So try to put that on your calendar. You can RSVP by calling 461-6060. Here in town, that's 904-461-6060. 461-6060. When we come back, we're going to spend some time talking with Dr. DePasquale about a particular topic. That we always pick a topic each week. And our topic this week is?
It's hoarseness.
We're going to talk about being hoarse. That's right. And I've encountered some people in the last week or two that have been hoarse. So we're going to talk about, well, how does that happen? Why does that happen? And we're going to learn a little bit this morning as we keep playing the music and doing what we do here. 1 minute now after 8 o'clock at St. Johns County's 99.5. Martha and the Vandellas here on 99.5 WSOS and AM Radio 1170, streaming this great music all the time, too, at staugustineradio.com. It is Friday, and we're live in St. Augustine. A beautiful morning here. A little sticky, which is kind of par for the course for this time of year. 78 degrees on our way up to a high of 90 degrees, a 30% chance that we may see a shower at some point after 3 or 4 o'clock this afternoon. And Dr. DePasquale joins us here live in the studio, as she does every Friday morning with St. Augustine Ear, Nose, and Throat. And as she was mentioning earlier, we're going to talk about hoarseness. What makes someone hoarse, right?
It's a great topic because around this time of year, we see a lot of people that are hoarse. Football season just started, and sometimes we get a little too excited, and that's one of the reasons people can get hoarse, amongst others.
Yeah, so we may have some New England Patriots fans that are hoarse this morning because they were screaming for Tom Brady and company last night in their big win in the NFL season opener. What causes you to be hoarse? I mean, why suddenly, but just because you're, speaking louder, that you would start losing, in effect, your voice?
Well, what happens is the vocal cords, they're very delicate little structures. And what happens is when we slam them together very quickly by speaking really loud or shouting, what happens is we get quite a bit of swelling around the vocal cords. And in some cases, we can even develop a vocal cord hemorrhage where blood collects inside the vocal cord. So all of a sudden, people are hoarse the next day. Sometimes you notice it immediately after your voice use, but it's very, very common.
Wow. So this can happen from obviously yelling at football games. What are some other things that bring about hoarseness?
There are a lot of things that can cause hoarseness. Some that are cancerous, vocal cord cancers can cause hoarseness. Some that are benign, like vocal cord nodules, vocal cord cysts, and polyps. So there are a lot of different things. Also, as people get older, we can also experience what we call bowing of the vocal cords, just because the muscles have gotten weak, and that can cause pitch changes for a lot of people. So, for example, if you're a woman, you may notice that your voice becomes a little bit deeper and you sound a little more like a man. And interestingly enough, sometimes the men will start to sound like women.
Really?
Yes.
That's my problem. That's
I don't think so.
Wow. So, and with kids, I guess, is there a concern that if a child is, hoarse a lot, that it could be an indication of something more significant?
Well, with children, it's usually different. I mean, of course, we're not worried so much about cancers, but
Right.
There are some other diseases that occur in children that we need to be worried about. Reflux is one of them. Children can get laryngitis. Children can have allergies, which lead to postnasal drip, which leads to throat irritation and things. So those are the most common things that we see in children.
Right. Smoking, I would imagine, can impact things as well.
Absolutely. Smoking is probably one of the worst things we can do. It causes several problems in the vocal cords. First of all, there's constant irritation from smoke on the vocal cords. And as I mentioned, they're extremely delicate structures, so they don't like it when you smoke. I see patients that have a lot of what we call edema, which is severe swelling of the vocal cords, and it's often from smoking, something called Reinke's edema. And that has to be surgically addressed.
Wow. Okay. So when people have some vocal issues, I've heard of people having, vocal cord treatments or voice treatments because they suffer from chronic hoarseness or what have you. What would that entail?
So vocal cord problems that are chronic can be a lot of times they're probably something like nodules or something to that effect.
Right.
And many of those issues can be treated with voice therapy, just treatment on how to use your voice properly, not to, misuse your voice or abuse your voice. So many times we can do something very minimally invasive like that. But if there are some things that have to be surgically addressed, like polyps, cysts, et cetera, et cetera.
So spouses or bosses are yelling at us, we can say, that's really not good for your health, your vocal cord health. You should speak in more moderate tones.
Absolutely. I think that's what exactly we should say.
So we could use sort of a more medical approach. You say, Dr. DePasquale was talking about you just this morning, and you're yelling, and how we need to stop that for your own health.
I really hope that's not what still happens in the world. People are yelling
You'll
at
be
their
surprised
voice, really.
what goes on at other workplaces outside of St. Augustine, ear, nose, and throat. Oh, man. Hey, when we come back, we're going to continue to talk about hoarseness and what causes it, and also touch on throat cancers as well. So stay tuned. Dr. DePasquale is in the house, and she is every Friday between 8 and 9 o'clock. You can learn more by going to saent.net. Of course, that stands for St. Augustine, ear, nose, and throat. saent.net.
Of the voice, or also pitch changes. So any of those things really can be defined as hoarseness.
And that can come from, obviously screaming at football games, that sort of thing, or at a particular event of some kind. But it could happen for some other reasons too. So remind us about what some of those other causes might be.
Other causes are vocal cord nodules. That's typically what we find in singers. You could have hemorrhage of the vocal cords. You could have acid reflux. You could have cysts. You could have polyps. Multiple reasons that one could be hoarse.
Can someone have like cancer of the voice box? I've heard that expression used.
Absolutely. That's actually what Michael Douglas had, maybe, what was it, a year ago or something like that? So he had cancer of the voice box.
And he was still able to maintain his voice.
So that depends on how large the cancer is and what
Right.
areas are affected by the cancer. So I don't know the specifics of what happened with him, but sometimes we see patients that have a very small cancer on the vocal cords, and that can be easily removed, resected, and sometimes there's really no major issues with the voice. But of course, if you have a larger tumor and it affects the whole cord, and if it causes the vocal cord not to move, then you have a much more serious issue with your voice.
Is that a cancer that typically does not spread that aggressively, or does it? Or what's your sense of that?
Usually it does not spread aggressively, and if they're caught early, the prognosis can be really, really good. The problem is many times people don't seek help. They don't get looked at, and next thing you know, it's gotten much further than it should have, and then the prognosis is much worse.
And a symptom, I guess, for that sort of cancer of the voice box or the larynx or whatever would it include hoarseness?
It definitely would include hoarseness. Sometimes people have, they cough up blood or spit up blood. I mean, it just depends what stage things are in. Sometimes they feel like something's stuck in their throat. Sometimes they could have difficulty breathing if it's gone too far. Sometimes they can have difficulty swallowing. So there could be a lot of different symptoms associated with it.
Speaking of that feeling, Dr. DePasquale, of having something stuck in your throat or having to swallow over and over again, that gets into some of the reflux issues. We hear a lot about acid reflux and all the commercials that are out there, and a lot of people clearly dealing with those issues, but those issues can impact your vocal cords as well.
They can. And what's funny is that it's very different when acid reflux affects the voice box than when it affects the stomach. Many of my patients may not actually have heartburn that they complain of, but they feel like something's stuck in their throat, or they feel like they have to clear their throat, but nothing really comes out. Those are the most common things that we see in an ENT practice. But, once the reflux is treated, often the symptoms are reversible. So, it, definitely is worth getting things looked at so we can identify and treat it appropriately.
So it would seem like our vocal cords, even though they're delicate and fragile, but in a way they're tough as well, right?
Yeah, they are pretty resilient, surprisingly, what we can do, and then they recover pretty quickly if you have the right treatment plan.
Right. It would strike me similar to, looking into someone's ear. When you look at the larynx or the voice box as a human being, I mean, is it an amazing thing to you that we're able to communicate the way we are with that structure?
It is. And what's so impressive is that they're so small, and what they represent so much. When you don't have your voice, you realize how much you cannot communicate with people. And that's a common complaint in some of my older patients. They feel they're on the phone and nobody can hear them, or they really get bothered by the fact that so-and-so thought I was a man when I'm a woman, and vice versa. I can't talk to my family on the phone because my voice gives out and all my family lives far away. So there are a lot of factors at play when our voice is affected that we may not really think about.
Dr. DePasquale is with us from St. Augustine Ear, Nose, and Throat. And if you have any of these vocal issues, we encourage you to seek their practice out for a consultation right here in St. Johns County. Go to saent.net. That's saent.net. And that's St. Augustine Ear, Nose, and Throat. We talked a little bit earlier, Dr. DePasquale, about ladies as they age getting a deeper voice, and oftentimes men as they age getting a higher voice. Is that some higher being just having a good time with us, or what's going on here?
So typically what happens is the vocal cords, they'll start to bow as we get older. So because the vocal cord muscles have become weakened, a lot of times, the weakening of the nerves and the vocal cords will cause these pitch changes in our voices. So again, if those things are happening, it's definitely important to have a diagnosis and a treatment plan. The best way we can look at these items is by a test that's called video stroboscopy. This is unique to our practice. Nobody else in St. Augustine has it. We insert a small camera through your nose down into your throat, and we can take a look at the vocal cords. What I love about this is that there's a strobe light that slows down the vocal cord motion so that we can see subtle irregularities that are not otherwise seen by conventional methods.
Wow. What a cool toy that is, huh?
Oh, it is a cool toy.
That was fun taking that out of the box the first time, wasn't it?
Yes. We've had it for many years, but I love it. We can see so many subtle irregularities that are often missed.
See, that's where we miss out on where Dr. DePasquale is not on TV at the moment, although she will be later on today. But her eyes just all lit up, and she got all excited when she started talking about that cutting-edge technology and the toy that they have that nobody else has. But anyway, she's very good, obviously, at what she does, and she's been doing this for a very long time. If you know someone in your circle of friends, neighbors, family members who perhaps suffer from chronic hoarseness, encourage them to at least call and schedule a consultation with Dr. DePasquale or a member of her team at St. Augustine Ear, Nose, and Throat here in St. Johns County, with offices located on the island as well as up in Ponte Vedra. You can call them, too, at any time, 904-461-6060. That number again locally, 461-6060. We'll be back with Dr. DePasquale in just a moment. Stevie Wonder here on 99.5 WSOS, and we're spending time this Friday morning as we do each and every Friday morning between 8 and 9 with Dr. Kalpana DePasquale with St. Augustine Ear, Nose, and Throat, with practice locations on the island and also a new one that's, it's open right now, right, in Ponte Vedra? You're just having your grand opening soon, yeah.
Correct. We opened a couple of months ago and finally getting around to the grand opening on September 30th.
That's right. That's going to happen on Wednesday, September 30th between 4 and 7 o'clock. And if you'd like to attend, you can RSVP by going to, or just calling 461-6060. That's 461-6060, or go to saent.net. I would imagine a lot of your patients, especially around Palencia and Nocatee in that area, they'd love that location.
Oh, yes. And World Golf Village, too, is really easy for them to get to as well.
Okay. Hey, we were talking this morning about hoarseness, something that a lot of us can experience. A lot of people experience it just from yelling at a football game or a party or having teenagers. But, the rest of us may have some other issues. And indeed, you could be suffering from a neurological disorder of some kind if you experience chronic hoarseness, correct?
Yes, this is something that most people don't think about. But there are diseases like Parkinson's disease or people who have a stroke or something called spasmodic dysphonia that can cause issues with the voice. And these are just things that most people don't really think about that needs to be identified.
So can hoarseness be an indicator of a neurological disorder? Or is it typically something that happens after the neurological disorder has probably already been diagnosed?
There are definitely patients that I've seen with hoarseness that we've actually helped identify the neurologic disorder, because there's certain disorders that we see characteristic stroboscopy and a certain way that it presents. And then often I tell them, I think you've got something going on. Let's send you to a neurologist to see what they have to say. And often they come up with a diagnosis of Parkinson's or whatnot. So it's very interesting.
14 minutes now before 9 o'clock, 80 degrees here in downtown St. Augustine, and we're live this morning with Dr. DePasquale from St. Augustine Ear, Nose, and Throat. So these parents and grandparents who go to Pop Warner football games or whatever, and they're yelling and trying to cheer little Johnny on, a lot, over and over again, week after week after week. Is it possible to just yell and get hoarse too much to the point that it does cause permanent physical damage with your vocal cords?
Absolutely. That can happen, because what happens is when you're screaming like that, as I said before, you're really smashing those vocal cords together. And what then happens is we get swelling, we get irritation, and from there you can actually develop scar tissue. So they can definitely lead to permanent dysfunction.
Right. We learned off the air that Dr. DePasquale not a big fan of spiders. And sometimes that results in screaming
at my house.
So when you scream, when you see a spider, does it process through your head quickly? Well, I will scream, but I'm not going to scream that loudly.
Correct. I scream loud enough for somebody to come and help me.
That's right. It's more of a cry for help. It's not a real scream. Oh, man, that's funny stuff. So why is it important, if you have this chronic hoarseness issue, to go and see an ear, nose, and throat doc as opposed to just anyone?
The reason is that we have a way to see the vocal cords, which most physicians don't. So we have that video stroboscopy that allows us to have a little camera that goes in through your nose, down into your vocal cords, so we can see how it moves, what the vocal cords look like. We can identify so much more. And then from there, we're also in a position that we can treat those issues depending on what it is. It could range from medication to voice therapy or surgery. So it's a one-stop shop. We can identify and treat the problem at hand.
There you go. Well, once again, that's Dr. DePasquale with St. Augustine Ear, Nose, and Throat. We're talking about hoarseness, but obviously any issues relating to the ear, nose, and throat area, Dr. DePasquale is expert in, and we encourage you once again to call their office and schedule a consultation or refer somebody that you know who's having these issues. 904-461-6060 is the telephone number, 904-461-6060. And indeed, later on this morning, we can see you live on television, right?
That's right. At 11 o'clock, I'll be on Channel 12. We're talking a little more about hoarseness, but on television, you may be able to see some very interesting photos of what some of the disorders that we're talking about look like.
Okay, good stuff. All right. Once again, that is at 11 o'clock, right?
Yes, on First Coast Living, Channel 12, WTLV.
There you go. All right, we're going to be right back with Dr. DePasquale here on 99.5 WSOS. The Beach Boys here on 99.5 WSOS. Hope you're having a good Friday morning. It's about 6 minutes before 9 o'clock, and Dr. DePasquale is wrapping up her time with us this morning, but we've learned a lot about hoarseness. And I guess in summary, Dr. DePasquale from St. Augustine Ear, Nose, and Throat, if we have hoarseness on a chronic basis, I mean, it happens a lot, what should we do?
So if you have hoarseness that is either recurrent or is lasting for more than 2 or 3 weeks, you really need to see an ear, nose, and throat professional so that you can get diagnosed and treated and well on your way to recovery.
What if somebody out there says, well, I experience hoarseness, but it tends to be tied to allergies. I have it only this time of the year.
Wow, we don't have enough time to discuss that issue. That's a pet peeve of mine. Everybody seems to think everything is caused by allergies. And yes, it can be a contributing factor, but it's not always allergies. I hear that so much sometimes. It's crazy.
That's one of the interesting things that I've learned from my time with Dr. DePasquale. I've learned a lot, but one of those things is that so often we just attribute everything to allergies, and we think that if we just go and get some Claritin or whatever, life is going to be fine. But so many of these things that we think are allergy related are really sinus issue related, right?
They can be sinus issues. So many people who have sinus issues, 50% actually think that they have allergies, but in fact they have sinus issues or sinusitis.
So there may be, and we think there are, a lot of people out there in greater St. Augustine and St. Johns County who maybe even regularly taking allergy meds, over-the-counter allergy meds, and don't really have allergies, right?
Absolutely. I see it all the time.
Wow.
All the time.
And that's just not good, because obviously taking any medication, whether it's over-the-counter or prescription-based for allergies when you don't have allergies
is not a great idea. Then you just have side effects and you're not really helping anything. So
Right.
not the best idea in the world.
So maybe the takeaway, at least the takeaway I would get from listening to you, Dr. DePasquale, is if you're someone who has these, quote, allergy effects, or you're suffering these chronic effects of allergies over and over and over again, and you're not getting any relief from taking allergy meds, right? You should go see Dr. DePasquale or a member of her team at St. Augustine Ear, Nose, and Throat and find out if there's a way that can actually help you.
Absolutely. And I think, Kevin, you've learned so much that I think you should come help us out in the office later today.
I want to get a white do I get a white lab coat?
You can have a white lab coat. You're going to help us out.
Lab coat. I don't think, do people even wear the white lab coat anymore?
Yes, we do. We wear them all the time.
That's good.
That way, if somebody coughs or sneezes on us, we've got some protection.
I mean, so often now when you go to like a dentist office, everybody's in like the multicolored scrubs. I want the Marcus Welby thing. I want the white lab coat. I want you to have a stethoscope around your neck, even if it doesn't work. It just makes me feel better.
We have stethoscopes. I don't really wear them around my neck, but I definitely have a white coat.
But you ever see the doctors on TV, like on Grey's Anatomy, they always have the stethoscope around the neck.
Oh, yes. It just looks cool.
But that doesn't really work, does it? Like when you're actually doing your job all day long, doesn't it get in your way?
They would get in my way because I'm an ENT. So we will listen to heart and lungs, just as part of the exam. But my main focus is ear, nose, and throat.
Hey, before we let Dr. DePasquale go back to work and stop playing on the radio with us, we want to make you aware of a great event that's coming up that's going to be on Wednesday, September 16th, which is next Wednesday at 6 o'clock. Dr. DePasquale will lead a discussion that's not going to take too long. It's going to have a long Q&A period for, at least 30 minutes or so probably, right?
Usually, yes.
And this is going to take place at Flagler Hospital in the Osceola Conference Room. And this is part of a seminar series that Flagler Hospital has. And what are you going to be talking about?
We're going to be talking about chronic sinusitis and what are the symptoms, how do we diagnose it, and also minimally invasive treatment options for treating the problem.
Yeah. So you can learn all about that. So if you're somebody out there or you're a friend or a loved one of someone who has the following problem, then you should go to this event. What are those problems?
The problems are postnasal drip, nasal congestion, facial pressure, decreased productivity, difficulty sleeping, all of the above, and then some.
So this is a great way to go learn a little bit about it. You're going to be with some friends and neighbors there, and you can ask whatever questions. You can also probably get to speak, privately with Dr. DePasquale. Usually afterwards, there's a little period of time, right,
yes,
where you can talk to the doctor one-on-one. And not only that, you also get free snacks.
You do get free snacks. It's awesome.
So it is actually. I've been to one of these before with one of Dr. DePasquale's colleagues, and they're great events. And not only that, you go there at 6, you're out of there at 7. It's very quick, but you learn a lot of information in a brief period of time, and it won't cost you anything. All you have to do though is RSVP, so they know how many snacks to have. And you can call Colleen at Flagler Hospital at 819-4758. That's 819-4758. So please RSVP if you can. We'll put that up on our Facebook page at WSOS Radio again. But this event taking place on Wednesday at 6 o'clock, and Dr. DePasquale will be there live and in person, right?
That's right, live and in person. Looking forward to it.
All right. Dr. DePasquale, thank you very much for your time. And once again, if you have any questions about her practice, check out the website saent.net. That's saent.net. And then check Dr. DePasquale out here in a couple of hours live on television. At what time?
At 11 o'clock, Channel 12.
There you go. All right. Have a great weekend, Dr. DePasquale.
Thank you. You too.